So don't worry about taking notes from these. You will get the slides as well as some additional handouts that our panel guests have supplied. So we're super excited about that. As well, I just really wanted to thank our region. This is a regional event, and we reached out to all of our economic development offices, our chambers, our tourism office, and asked for their support for this event because it's really the start of a conversation of reopening. And while we don't have those guidelines yet, we do know that there are great tips and things that we've all been thinking about. So we're excited to share those. And so I wanted to thank those folks. You'll see shortly a screen that has everyone's logo on it, and we are so excited. I know that this probably means way more to us than it does for you, but to see our entire region, the Roanoke Valley, New River Valley, and Alleghany Highlands all on the same slide is fantastic. And if you all are here listening this morning, thank you so much for partnering with us on this. We appreciate your support and your love of small business. So with that, I'm gonna start the presentation and let you see all the good stuff that they have to say, and then we'll get rolling with our panel. Okay, so we are talking about mask friendly this morning, and we have some graphics very similar to this to share with you that we'll do at the end of the call today. But I want you first to hear or see some messages from our partners. And I should sing along because our music is not working. But I would imagine you do not want me to do that. So we'll just go through these folks. Downtown Roanoke, Inc. Botetourt Strong. Have some folks from Floyd. These are a lot of the businesses there in Floyd that had a message. And thank you, Roanoke County. You've been a great partner in all of this. And our Roanoke Regional Partnership that does so much good work for us in economic development in the region. And Pulaski, the town of Pulaski and Pulaski County. Thank you guys so much for your help with this and being part of it with us. So without further ado, I want to get started and introduce the panel of folks that are here to talk with us this morning. We have Kristin Adkins with the Roanoke City and Alleghany Health District. She's the population health manager there, and she's actually going to be talking with us first this morning. We also have Eric Terry, who's the president of the Virginia Restaurant, Lodging, and Travel Association. We're really looking forward to hearing what he has to say as well about what he's experiencing and some advice he has from us. And we also have Marc Willson on with us. He's a retail and restaurant consultant, and he's with us at the Small Business Development Center in our Virginia office. And I just love Marc and cannot wait to hear from him. You're gonna love his ideas and thoughts, and we're gonna talk a little bit more about what he does. And then we have Bob from Mac and Bob's on with us. So a business owner here in Roanoke that's going to talk to us about his experience and just kind of be part of our community conversation. So thank you guys for joining us this morning. And we're going to open up with Kristin. And Kristin, I'm just going to let you, I think your mic is unmuted now, and let you go forth.
Great, thank you. Good morning, everyone. We just wanted to cover a few tips from the health department, some public health and safety guidelines for thinking about running a business and having folks together, but keeping everyone safe during this time. So we've really been thinking of it in our team in these three kind of categories about keeping our team safe and keeping the people safe who come to see us. So the first one is screening the people who come in and thinking about trying to have your space be as safe as possible. And so when you have folks coming to you, you want to make sure that they are not sick. And so a great way to do that is to screen folks for a fever. I know thermometers can be hard to come by. So you can ask folks to do that before they come in, or if you can get thermometers, especially no-touch thermometers, you could do that as they come in. And really at this point, we're kind of advising that any level of sickness not be out in public. And so folks really shouldn't be coming to you if they're sick with these symptoms or any other type of kind of respiratory cold type of symptoms. And the second piece to that is really to empower your team to follow that guideline. And by that, we mean looking for opportunities to make sure that your team can stay home if they're sick. And so extending that ability to stay home, and so not punishing employees who stay home sick, or even offering paid leave for those folks if that's an option. The second piece is once they're in there with you, once they're in your space, think about how you can leverage the guidelines for social distancing. So making sure that anyone who has the ability to telework or not be in your space, kind of be at home, but offer any kind of services that you can remotely. I know a lot of our restaurants have even set up so that folks don't have to come in, moving your services online, etc. And then for those who do come in, really being serious about that social distancing, encouraging folks to say that 6 feet apart, that goes a long way towards preventing transmission. And I don't know about you all, but I just feel so much more comfortable when I go into a store whose signage and employees and teams are just kind of modeling that behavior and making me feel comfortable in following that. And so signage goes a long way. The tape on the floor to show folks where to stand, all of that is just an environmental change that makes people feel comfortable in being in your space and being a patron. And also your employees. So keeping meetings small, keeping folks 6 feet apart in meetings, whatever you can do. And lastly, really trying to eliminate the risk of high touch areas and sort of virus transmission through environmental cleaning. So up the amount of time that you're doing cleaning, especially those door handles and light switches and that sort of thing. At the health department, we've propped open as many doors as we safely can so that there's not as many things to touch as you move around our building. And then increasing the cleaning of those areas. And I know that those supplies can be limited, but do what you can to get a hold of those things that would sanitize and clean. All right, that's it for that slide. I did want to, on the next slide, just talk briefly about contact tracing. This is a kind of a core function of public health in the health department. We do sort of an epidemiological work to make sure that we kind of manage and understand where the virus is. And so contact tracing is when we find out that there's been a confirmed positive case. Our team with our epidemiologist reaches out and works with that individual to identify who has been a close contact. And that language is really important. And I'll talk about that in a minute, but who's been a close contact of that person. And those folks are notified by us and asked to please quarantine themselves for 14 days. And quarantine means you're not sick yet, but we're asking you to truly stay at home and not go out in case you do. And then if you develop symptoms, that's when we call what's called isolation. If you become sick, then you're isolating yourself in your home. But those close contacts is really key. And those are folks who have been within 6 feet of the person for sort of an extended period of time. So not someone that just brushed by them in the store, but folks who spent time together. And so the key takeaway here for me is you don't want to be someone's close contact, right? You don't want your team to be a close contact of a positive case. You don't want your team to be a close contact of a customer with a positive case, et cetera, et cetera. And so following those previous guidelines we just talked about will prevent that. And so when we have to come in and do contact tracing on a case, the fewer close contacts that person had, the better for our whole community, right? And so do what you can as you think of opening up, wearing cloth face coverings, enforcing social distancing, making that environment sort of friendly, and modeling that behavior with your team will go a long way towards sort of empowering our whole community to follow along what we're trying to do is set an example as businesses. Okay, next slide. This is just a flyer that has kind of the main prevention messages that we are really trying to push out there and that we are asking you to do as you sort of open your businesses back up. And that is to stay at home. So encouraging your team and your customers to stay at home, going remote as much as possible. Wash those hands often. I know that has kind of become like a joke, but that 20 seconds of rigorous hand washing as often as possible. When you leave a new space, when you enter a new space, when you come in through all the doors into your business, wash your hands, right? And that eliminates the risk from all those doors you just touched. Maintain the 6 feet of physical distance between yourself and others. Cover the coughs and sneezes, the masks, us wearing cloth face coverings, kind of the homemade kind, so that we save the medical kind for our medical community. But that really helps us keep in any viruses that we may be carrying around and not spreading them when we're out in public and in our businesses. Disinfecting, and of course, wearing that cloth face covering. So that's a flyer. If you would like to sort of have some signage up in your business as you reopen, we would be happy to get you access to a lot of things that you can post up. And that just sort of helps people feel comfortable when they're in your space. Okay, next slide. There have been a lot of conversations around what flattening the curve is and what it means. And of course, we are really doing a great job of that here. We are trying to keep this under control. And while we do have a steady kind of slow increase of cases, we have not had a spike that has exceeded the ability of our healthcare systems. And so that has been a very powerful tool, and our staying at home, even before we had our first cases here, has really leveraged our community's ability to flatten this curve. And so kudos to all those who have been following guidance. And as far as recovery and reopening, we are still seeing an increase of cases here locally. And so at this point, it's really hard for us to predict what that looks like. But we are anticipating that that's going to mean there's still going to be ways that we're going to have to keep ourselves safe even when we reopen. And so some of these strategies are going to be with us for a long time. Okay, next slide, please. I did want to share with you some resources that we have set up that are available to you as our community associations and businesses. The first is what's called our Health Department Operations Center. And we have set up an emergency response and incident command system. And we have 4 phone numbers set up so that you can reach someone at the health department quickly and easily to ask any questions you have. And those phone numbers are there. Those are for organizations, for our medical community. Those are not really for the general public. But for the general public, we also have more of a call center set up. And that is available Monday through Friday, 8 to 6. And in the presentation, I've included the flyer for that. So if that's something you'd like to pick so that folks can kind of think through their questions with a public health person, then that call center is a great option. And most recently this week, we've offered a phone line in Spanish so that folks can call in Spanish and get to someone who speaks Spanish right away. And so if you'll skip to the next slide, that is the flyer for our public call center and the Spanish call center. And so feel free to post and share those as you would like. Okay, just wanted to talk briefly about social media. I know that's a big strategy for a lot of you all in your businesses, and it is for us as well as far as pushing public health messaging. So the next slide has a link to our Facebook page, which is fairly new. And so we'd appreciate any help that you can provide as far as helping us kind of grow that page and getting the public health messaging out there. Of course, your other public health organizations have those as well. Just also wanted to share briefly, because I know a lot of you are utilizing social media, just a request to please consider what you're posting right now and kind of use photos that demonstrate these activities that we're asking everyone to do. So when you post a photo of your staff kind of getting back ready to open back up, think about making sure that they're social distancing in that photo. And if they're in a place where it's appropriate for them to be wearing a cloth face covering, have them doing that. Because when we put those, modeling that behavior out, behaviors are seen as normal, then much more people will be willing to kind of go along with that. So just think about the ways that you can help us do that through your own social media channels during this time. Okay, next slide. We did just want to mention briefly that the health department is also offering a training similar to this one, but very focused on this idea about putting together and interpreting public health guidance that will be with our infectious disease doctor and operations chief. And so if you have some more technical questions or would like to hear more, then we are doing something similar on Friday and would be happy to have anyone join us who can. And I think I can turn it over to our next presenter.
Someone has to unmute Eric.
Get Terry unmuted here for you guys.
Food product and things that you're ordering. The other impediment is the June 30th deadline on those and the 8-week cycle once you take the loan. And there are a lot of restaurants that don't feel like they're going to be able to qualify for that. So I know a lot of folks have figured that that's going to fix all the problems. It's got some challenges. We're hopeful in the next CARES bill, which hopefully is 4. I don't know when that's going to happen. They'll fix some of that. Of course, they refunded a big chunk of those. They have not refunded the EIDL program as of yet, or brought that. We will run out of money in the next couple of days. The overall reopening procedures, I think that we're focused on are how do we sort of get restaurants open in some way that customers are going to feel comfortable. We talked to the governor's office. We have probably 1 or 2 conversations a day with the governor's office about reopening and grant programs. They've announced a couple of smaller grant programs, one through Go Virginia, another where we'll actually be giving out some grants probably later. But I would encourage you, you can go on and you can actually buy some. We've gotten a lot of support. Tito's Vodka, Heaven Hill Distilleries, and
in their shopping small over the course of the next few months. Thanks for bringing that up. And I wanted to show you guys, we have a couple of flyers that we'll get to you from Eric and Brittany over in our chat group. If you pull up your chat, she has linked there a couple of virginiaforrestaurantlovers.com links that might be helpful. So you can go over there and grab those and open those up in your browser. And we'll also make sure that you have these flyers and resources in your hands later today. So thanks, Eric, so much for joining us. And we're looking forward to, I've got a couple questions for you later today. So we'll go through those. Let's meet Marc. Marc Willson is a retail consultant and restaurant consultant with the Virginia SBDC office. And we're excited to have him here. I've worked with Marc before, and some of you guys might know him. He's come and done workshops for us and met with some of our clients, and I'm really excited to have him here with us today. So I am going to turn it over to you, Marc, to talk a little bit about what you're seeing on your end with retail and restaurants.
Okay, so I'm unmuted.
You are. I think everyone
can all hear me.
Thank you so much.
So
yes.
I didn't really prepare a slide.
goodness, we've been hit with a fire hose of information. And I've looked at almost everything I can get my hands on, because for me, I've met with thousands of businesses across the country, and my wheelhouse is really small towns and mom and pops, and trying to compete against the Amazons of the world and the Walmarts of the world. And, you know, we've done a pretty good job of revitalizing our small towns. We were moving in the right direction. And now we've been hit with something we've never been hit with before. I spent weeks at on the Virgin Islands for 4 weeks after the hurricanes, getting them reopened. I spent 4 weeks in New Jersey after Sandy, getting the businesses open in New Jersey. And I spent some time in Northern California for the towns that suffered because of smoke and mudslides. So business has been disrupted in the past with disasters, but this is more than a disaster. This is not something that comes and goes away. In the other 3 incidences, we had an end date and we were able to rebuild. We actually reopened, vigorously reopened the stores. We had grand reopenings, and I'm not sure that the atmosphere is right for that, but I do want to make sure that we know that we have to message our customers. And this thing, I'd throw this in right now. We should be talking to all our best customers throughout this process. You should be in constant contact with your customers right now. In fact, you know, I spent years, and I've been doing this is my 11th year in counseling, telling small businesses that it's all about the experience, and that, you know, let the people go to the internet that want a commodity or don't need any service. But in the small towns, in the small mom and pops, we're going to give the customers something they can't get anywhere else. So we have a unique situation here because we have the population, there's a pent-up demand for social interaction, but it's tempered with an abundance of caution. So we have this fine line we're walking on, trying to reopen and give them something that they really desire right now. But on the other side, we have to be very careful that it's safe for both our workers and our guests. So it's not going to be an easy task, but it looks like we're moving in the direction. So I always have said that this is a now situation, a next situation, and a new situation. So we are in the tail end of now, which is the businesses that have been able to stay afloat, because I know from being involved with the SBDCs, everybody is wanting to know where the money is. They're dying for it. They need it. They've gone from income to no income. And I'm talking about retailers and restaurants. Restaurants have been able to have curb service and delivery, and so have retailers. But it's not what we're used to. It's a new normal. So we're at the end of now, moving into the next. And the next will be really kind of explained to us through the governor's proclamations on phase 1, 2, and 3. But we're moving quickly toward phase 1, which would probably still be curbside service and delivery for retailers and restaurants. Phase 2 is where you start letting people back inside your 4 walls. So I think we'll start with phase 1. Hopefully we'll move into phase 2. Phase 3 is where we believe, well, I think phase 3 won't come into play until there's a vaccine. Because to climb out of this, we've got to have a vaccine. And by the way, the pandemic of 1918, the Spanish flu, took 2 years to come out of. World War I, 4 years. World War II, 6 years. The Vietnam War, 8 years. So the country's been through things like this before, but nobody in our lifetime young or old, have lived, well, I guess there's some folks that might have been around for the Spanish flu, but we haven't experienced anything like this before. So I think the important thing is to exude confidence and advertise that your business is thoroughly prepared to provide an exceptional experience in a safe place. And that's what we can do now. That's how we get off the dime. And we're moving that way quickly. And the way that message can't be conveyed necessarily in a store or in a restaurant right now with 6 foot different distance. And we're moving from a high touch businesses to a lower touch business, which means, the same touch, feel, camaraderie, closeness that we had with our top 20% customers is going to be more difficult to maintain and create. And I think most of that message has to come through your website and your social media channels. So my advice to my businesses during the now was fine tune your website. If you don't have e-commerce, take your top 10 best-selling items that have margin, put pictures of them on your website, and encourage your customers to call you. Don't wait to implement Shopify or Wix or any of those other Square, any of those other e-commerce platforms if you don't have one now. Just go ahead and get them on your site and tell your customers to call you. So for the first time, I'm encouraging small businesses to adapt and trust in online business. I would tell you that going forward, and I've talked about this before, and now it's more important than ever, the omni-channel retailer and restaurant will have more chance of surviving and thriving than for folks that have not embraced their website, because it's the number one thing you got to have. It far outweighs social media, because you want to be the result of a Google search. So your Google My Business is probably one of the most important things businesses should be doing right now, because my old adage was get found, be open. Now my adage is some people see disruption, other people see opportunity and innovation. My message is it's a new normal. This pandemic is social changing. Business will not be done like it was in the past. It'll be a modified or adapted approach that provides both an unbelievable experience, but backed up, buoyed up by the internet and your digital marketing and digital offer. So I can talk about this for hours. I've done this. I've run businesses. I didn't learn this in a book. I lived it. So I got lots of things I can share with lots of folks. So without further ado, I'd like to get to where we open this up to Bob. And then after Bob, we open it up to you all that are here to participate and ask questions. Thanks for hearing me out.
Marc, thank you so much for talking to us about what you're seeing and experiencing and taking in on your end. I know that we have so much information coming in, and we really appreciate you kind of nailing that for us and talking about what our retailers and restaurants can do. I want to turn it over to Bob, who is with us today from Mac and Bob's, owns a restaurant here in Salem. Bob, let's see if we can get you unmuted here. And I'd love to just hear from you and what you're thinking about as our topics, our minds are starting to go towards reopening. What are some things that you've seen and that you're doing? Just talk to us a little bit about your experiences.
Yeah, sure. So when this whole thing was about to happen, my wife and I went got away for the weekend, and just to try to get my thoughts together. It was a weekend right before St. Patty's Day, which is a very big day for us. And I wasn't sure if we were going to be able to open or not, and not really sure where we were going to go. And when we were having dinner, I guess it was on Sunday, we were in a little town in North Carolina, little getaway, and then got the message that the governor had said, no more than 50 people initial. Then we decided, okay, got back to the restaurant on Monday, had a meeting and said, look, we're going to have to close tomorrow, and let's just figure out where we're going. So we closed on that Tuesday, and we went ahead and paid all of the servers and bartenders and cooks a couple of weeks of pay so they can bridge the gap between filing for unemployment, not knowing when and if we'd open up again. So we took all of our product, which we get, the vast majority fresh, and we decided to freeze it and wait and see what New York was going to do in terms of restaurants and what the trend was. And that's when they went with the curbside, and we went ahead after, I guess about 9 days, and decided to open up with the curbside. And we were fortunate for a few things. To kind of piggyback what Marc was talking about, I'm very fortunate that, excuse me, I'm 64 and I've got three daughters, and my eyes are young, but one does our website, and she's a graduate of Virginia Tech, and she was a graphic design artist, and she does my website, which is great. And my youngest daughter, Maggie, does our social media. So at the same time, I was getting my doing some search engine optimization research done for one of my daughter's friends, and put ourselves in a good position. So we were in a good position in that sense. And we also just recently turned over to a new point of sale system called Toast, which is very state of the art. And that helped us a lot with the curbside. And I really am pleasantly surprised at how the curbside is working for us. We have a nice large parking lot to the side of our building, and we put a ring.com camera up there on the corner of the building, so we can see when the customers come in. And we have 4 phone lines, and we have actually 6, but we only use 4 because we can't take the volume during the peak times. So we they call their order in, and we have curbside where we can see them coming. We tell them to stay in their car. We'll bring it out. They can open their back seat, open their trunk, whatever. It's like a no contact, and we put their food right in their vehicle, and it's working very well. And we have a large enough kitchen that we redesigned our kitchen a little bit. We have a reduced menu, and we closed what we call our saute area, and we spread the kitchen, the crew out, and we sell a lot of calzones in our restaurant, and that's probably the tightest area in our kitchen. So we got another refrigeration unit that has the same ingredients, and they are separated so that we don't have like 2 or 3 people like right shoulder to shoulder. So that's worked well. The unfortunate thing of the way the business is that January and February are our 2 slowest months, and April's our busiest month by far. So lockdown wasn't a good timing in that sense. But we're doing about 35 and some days 50% of sales, which surprises me, and I'm very happy with that. We were fortunate too that we bank with Bank of Botetourt, and I guess being a smaller community bank, we applied the first Friday for the PPP loan, and we got the money in our bank the following Friday. So that made us sleep a little bit at night, that we can at least extend our downtime. And the thing that concerns me, though, we have like over 9,000 square foot building, and our occupancy cost is based on what our sales are, and our sales are going to be 30, 40%. And even with the 50% capacity, we still have to make some decisions, and our budget is based on, 2 deep at the bar, 2 waiting lines inside and outside, and a foyer packed with people. And like Marc mentioned, those days are gone for a while. So it's every day is a new thought, and we've got some good people, and we meet constantly and figuring out what the next step's going to be. But so far, I'm very pleased with the way the way it's working. Like I said, every day we kind of change things for improvements and get some really, really good ideas. And I was telling Heather and Catherine that yesterday was really a surreal day. My daughter does the social media for us. Actually got on our roof of our restaurant, and we had Community Church of Salem. Their congregation and their pastor, Tom McCracken, want to help restaurants. So last week they went to Mama Maria's and had over 80 people, and they do their sermon. They bring in their loudspeakers, and they have music and an actual sermon, and people sit in their cars and tune into an open FM station, and he preaches his sermon, and then they pass around a collection plate, and they got $800, I think, at Mama Maria's, and we did ours yesterday, and talk about a different situation. At what I do at our restaurant is I constantly walk the floor and talk to customers. I know my customers fairly well, and it was funny because we were had speakers and pagers and walkie-talkies, and I would say when they called their order in the morning, they called between 9 and 11 and gave us their name, their make of car, their color, license plate. And when they pull in, I would say, spot number 11 is the McCarthy family, and they would get the McCarthy order ready to bring it out to spot 11 on our floor. But I made the mistake of, we have a table 50 in our restaurant, and I said, this family came in, the Smith family came in a table 50, a parking lot 50. And it was just like, instead of me going around and talking to customers at the tables, I'm talking to them through their cars. And it's a little change of pace, but we're adapting as things go on. But they raised over $1,000 for our staff, which is really incredible. So it was fun coming into the kitchen after the shift was over and saying, "Here you go, guys." They split it up, and they were very, very happy. So I want to share with you too, just real quickly before I move on, a check or a letter I got yesterday in the mail. It said, "We are reaching out to you because we are not for this horrific pandemic. We would be visiting your restaurant to enjoy your fine food, drink, and service. We'd like to say thank you by paying forward a portion of the money that we received as part of the government's economic stimulus. Please use this thank you as you see fit to best support your business. We look forward to dining with you again. Jeannie and Greg," and they had a check for $100 just to Mac and Bob's. So we're all kind of going through this thing together, and to me, hopefully the sooner the better. But I'm in the trenches right now, and I can add, I guess, a voice of actually being there and how we're adapting. So thank you for your time.
Bob, thanks so much for sharing that experience. We love hearing from you guys that are in the trenches and letting us know kind of what you're going through, but also what we have found so important through this is just to know that we're all feeling a lot of the same things. So thank you for sharing that. And I wanted to pull out a little nugget that I heard you say that could be really important for some of our other businesses that are online with us today. And it's that to do your, pull up, you can pull around and get your food. You didn't have to use fancy equipment to do that. If I heard you correctly, you were using the Ring camera.
Yeah, $250.
What was it, Bob?
$250 to hook it up.
Yeah, so that it's not like the fancy stuff. It's little things like that you can get your hands on. So that was a really cool little nugget that I pulled out of that I thought might be beneficial as a tip for those who are trying to figure that piece of it out if they haven't already. Thank you so much for joining us, Bob. We really, really appreciate that. And I hope that, I know there's going to be some questions here coming your way. So let's talk about, or open it up, I guess. I'm going to allow you to unmute yourself. If you would stay muted if you're not talking, that allows us to have the best audio experience. But I am going to give you an opportunity to unmute and ask some questions to Kristin, Eric, Marc, Bob. If you have specific things, I've captured a couple that we have going on here in chat. And then I'd also like to invite you, just if you have tips or things that you're doing that you think other businesses could benefit from, we'd love to hear that. And before I open that up, I just wanted to share that this event really has been impromptu, super, super fast putting this together. And the reason that it happened is we were talking to small businesses, but also as consumers and customers of small business, and how important it's going to be going forward to make sure that your customers feel comfortable coming in to shop or doing business with you and wearing whatever protective gear that they would like to wear, whether that's a mask, gloves, whatever. And I know that many of us over the last month or so have had different experiences with that. I know that I've personally actually only been in a store 4 times since this happened. I make my husband go to the store for me. So I haven't been a lot of places, but there have been some that have been very mask friendly. If I have a mask on, I feel like I'm welcomed, and they have masks on, and even while it might not be everyone, I don't feel weird. And I had another experience, and I know many of you have as well, where I had a mask on. I went into essential business to get food, and I felt like a monster. Like I felt like everyone was kind of like talking and whispering and looking at me, and no one had mask on. And I thought, man, our small businesses really need to keep that in mind. And while you may choose not to wear a mask, I know that the health district recommends that we do, but if you choose not to do that, that's certainly okay, but make sure that your customers feel comfortable with whatever precautions that they want to take are. You've got some who are completely okay with not being 6 feet apart, and others that aren't. I went to a restaurant a few weeks ago, and there were far more than 10 people waiting in the lobby for their food, and it made me super uncomfortable. I think because I'm just in the midst of all this, and really wish they would have had tape on the floors. So there's just things like that that I think we can all learn from and think about as we wait for the more specific guidelines, and really thinking about that customer experience and what is that when they come in. Later today, we're going to make sure that you have the slides, the presentation, some of the handouts that you've seen with all the information on them. And we also have 2 graphics to share with you. They both look very similar with the mask, and they say we are mask friendly. And we're going to send you both of those graphics. You can print them out on a color printer or black and white, however you choose. And if you want to put those in your windows for customers to see, you are more than welcome to do that. They are not branded in any way, so it doesn't have any branding on it. They're just graphics that we created for you if you want to show your customers that you are mask friendly as you begin to open. So we'll make sure that you have those. Feel free to steal them, use them, post them, put them in your windows, whatever you'd like to do with them. It's just something we wanted to give you as part of this presentation. So I am going to allow you to unmute yourself. There we go. So let's start with questions. Does anyone have questions for Kristin, Eric, Marc, or Bob? Just unmute yourself and ask away.
Hi, I have a question.
Good.
Yeah, absolutely.
Yeah, this is Dolores Best. I own Book No Further in downtown Roanoke, a retail bookstore.
Awesome.
I am looking for information on physically how to prepare my store. Books are an interesting commodity that you can't wipe down with a wet rag. And I don't know if people have any suggestions on where I might find some resources. The industry's working on it and sharing things, but anybody that can offer some help with that, I'd appreciate that.
What a great question. Our bookstores are unique in that we like to go in and touch and feel and look. Does anyone have any thoughts on particularly the safety aspect of that? I know, and I'll check you out and see what you're doing, but I know that I would love to pick up a book if I could drive by and get it. It's something that I know I already want and that you have in your store. Kristin, have you heard of any guidelines for, and it doesn't even have to be bookstores. A lot of us have products like that people are going to be touching and that sort of thing. And anyone else on the call that might have advice?
I will certainly keep an eye out for guidance that would address that particular topic. I think right now, just because the focus has been to kind of avoid, so as we open up, I'll keep an eye out for that specific topic, Dolores, and I'll pass that along as I find it. Thank you.
Thanks much.
Hey, Kristin. This is Bob Rotanz. Would like a box of latex gloves work when they come in the door, and maybe check it out, and then you can move forward? I don't know. We've got availability at the restaurant industry. We can get, we buy cases of them. We use quite a few of them, but would gloves work possibly?
That's a great thought.
That might be a good idea that people would, you can encourage them. Unfortunately, our prime experience is hand selling the book, is looking at it and showing it to them and handing it to them, and that's exactly what we shouldn't do. But yeah, I'll talk to you then about the gloves. That might help.
And then offering some sort of hand sanitation for when they take those off, because taking off gloves can be very, problematic. But if they can then wash or hand sanitize, that would be a fairly good solution. They couldn't feel the book except for through their gloves, but yeah, that would kind of keep the germs, especially if they didn't touch their face while they were in there. That would be a great solution.
This is Jesse Phillips. I work as an industrial hygienist in the area, and we do a lot of work with both municipalities, but also industrial facilities. And one thing that I've seen that may be effective is installing, it may be hard to find, but an automatic hand sanitizer dispenser at the door, and require anyone who comes in to use that. And then, like Bob said, that's a good idea to have people don appropriate PPE like gloves, so that when they're handling objects or high touch areas, they would limit potential transfer of anything that's on their hands. But again, as Ms. Adkins said, encouraging them to limit touching their faces, and then doffing those gloves as they leave and disposing of those in a dedicated disposal container would be a good way to limit potential exposure.
Those are great ideas, Jesse. Thank you. Does anybody know if we can get hand sanitizer? I haven't been out to look for any. Is that still readily available for our businesses? Does anybody know? Have you seen?
I have seen very little available.
Yeah.
I purchased a couple of gallons from Twin Creeks Distillery in Franklin County. I don't know how much they have, but you can check that out. And I'm just trying to get my hands on anything I can when we start getting ready to open up again. And also we use it currently, but I know they have some, and I can only get 2 gallons. I wasn't going to try to hoard it, but I asked what was the max. They said 2 gallons, and it runs about $40 a gallon. I just spoke with somebody recently, I think it was just yesterday, that also purchased them somewhere else, and it was the same exact price, $40 for a gallon.
I love that you mentioned some of our breweries and distilleries are able to make that and offer it. That'd be a cool resource if you guys could get your hands on it.
That's in Franklin County. I don't know if I haven't said that, but they're located in Franklin County.
Awesome. What other questions do we have?
Amanda, this is Eric. I saw somebody in the chat had asked a question about the to-go ABC and some of those things.
Yes.
As it stands right now, I want to make sure everybody knows that we anticipate that that's probably going to go away when we sort of exit this. But we are talking to ABC and the governor's office about maybe retaining some of those to-go, being able to do that with your ABC license. And so hopefully we can maintain that in some form. I don't know exactly what that's going to look like.
Yeah, it sounds like there's unanimous thoughts about that here on our chat, that would be very helpful if they could continue to do that, at least for the foreseeable future. Perhaps if you haven't already, I'd also encourage you guys to advocate with your representatives so that they know kind of where you stand and how you feel. And we know that everything is going to be 100% when we go back, and that this would be a need for you all to be able to offer it. And certainly even as a consumer, I don't own a restaurant and never have, but as a consumer, I'm so thankful for those that are able to be open and be able to do that. It's really allowed at least a little bit of a feeling of normalcy, and I hope that can continue for sure, even as a consumer. Thank you, Eric. I'm glad you caught that. Thank you. There's a question here from Marc too. It says, is there a resource for reviewing e-commerce platforms that are smaller, for smaller businesses, and can review the features?
Not that I'm aware of. I think when I'm out talking, I tell people to look at, Shopify, Wix, and Squarespace. but I'm not sure. I guess we could Google it, but I'm not sure that there's any document that compares formats to one or others, but I could be wrong.
Yeah, Jennifer, I don't know of anything either. I work a lot in the marketing space, and we also have a volunteer on board with us. I think she's on the call today, Beth, who helps folks implementing online tools. If you wanted to chat offhand or just reach out to me privately here with a way that I could reach you, we could probably talk about maybe some options and what would be best for you. And then if we can we might pull Marc into that conversation too. But if you'll just send me a private chat with your contact, and we'll be in touch and see if we can talk through some of the features that might work best for you.
Okay, thank you.
Yeah, you're welcome.
Appreciate it.
Kristin, there's a question on chat for you from Terry. It says, what do you think of citizen science to multiply forces for knowing community health, like COVID near you? I'm trying to work on this in Pulaski.
I think I would have to understand what that is for a moment. So I'll look that up, and then maybe I can speak to it, or she can send me a link. I didn't see that in the chat box.
Kristin, this is Terry. I saw a webinar that came out of Penn State ECHO, which is, they're working with a lot of the hospital administrators and people in the medical world for a variety of topics. But the topic that I got to watch was on citizen science by Gavin McGregor Skinner, who's done a lot with infectious and natural disaster control in areas. And he's making an appeal for ordinary people in communities to help map the level of health. And it's been used in Ebola areas, hotspots around the world for Ebola and avian flu and things where you can kind of trace and track and just keep track of how community health is doing. And COVID Near You is one platform that's already out there to collect citizen science. So I can go on every day and say, I feel fine, or I don't feel fine. And he says it's just super, super helpful to have citizens relaying information into databases so that people can track, the medical community can track how the infection is spreading in areas. And it helps measure things, because y'all who are merchants, and I mean, I'm just a church pastor, but y'all who are merchants, restaurant owners, and businesses, for this whole phase 1, phase 2, phase 3, we need to know a lot of data about the spread of infection in order to know when the gates are opening from phase to phase. And so he makes a great case. I can send you the link if you'd like to that webinar, because he just gives a lot of evidence for how citizen science is used to help decision makers know what's going on in the community. So I need to talk to Pam Ray in our area down here at the health department to see what she thinks. But it's a force multiplier. It's just a way to really help knowledge grow through local citizens. So I just was curious if you had any idea about that.
Thank you for sharing that. I have heard of that as well, and I will share that with our team at the state.
I think if it's something, everybody that's listening in on this, if it's something that can make good sense, and I'll put a link to everybody on that webinar I saw, it's really compelling, but it means you got to get volunteers to help be a part of it if it's going to take any root in a community. But it's super compelling, and it's really exciting. And we haven't done much citizen science, I don't think, on COVID, but I noticed an article that one of the NPR stations put that said everybody locked in at home or staying at home is doing citizen science for biology projects and things around the world, counting birds and things like that. So I think if we're going to do citizen science, we ought to do it for COVID-19.
This is so, I disagree with you 100%.
How so?
What I'm hearing is science says the more we continue to lock ourselves at the house and home, the more we're distancing ourselves from being able to be susceptible. If we all stay home for the next 6 months, when we come back out, we're going to be so susceptible to every virus that's out there. Have you not seeing those articles from Harvard, CDC, NIH?
Well, that's a little different from what I'm talking about. I'm not talking about locking yourself up completely. Like I sort of used the wrong phrasing. I'm just saying that while we're doing the stay-at-home order, we can be contributing to knowledge about how communities' health is doing. That's all I'm saying.
For sure. Terry, if you would also share that link, I think we've got some folks who'd like to see it.
Okay. Thank you.
For us to check out. That's really cool. I do want to return the discussion back to tips as we reopen for businesses. And I'm looking through, I think we have most of our questions answered on chat. If I haven't captured one of those, if you want to just speak up and ask. And then if anyone has additional tips that have been really helpful for you as you've been operating during this time, or as you're thinking about reopening, I'd love to hear some of those directly from you guys. We're going to wrap up here in just a little bit, so I want to take probably 2 or 3 more minutes.
Amanda, this is Eric again. Let me speak to one thing. In terms of the phases that the governor is probably looking at, the first phase will likely be restaurant reopening the dining rooms at a certain level, that may be 25 and maybe 50%, or some social distancing guidelines. But we do anticipate that's kind of the first phase of what he's going to announce. And again, he is very, very focused on following the guidelines that came from the White House and making sure that we're sort of staying within that. So I do think whatever you're going to see probably, and I think you'll hear more on his Friday call about what he's thinking, and then again next week as we approach that May 8th date.
That's good information. Thank you, Eric. I know we're all anxiously waiting for that guidance.
Amanda, I would add that the stores that are doing Zoom presentations, they're taking the staff that's there and they're doing like a trunk show about Brighton purses via Zoom. So they've added this human touch to something they would have normally done anyway, but they are constantly, it's a jewelry store in Leesburg. It's called Ketterman's. And I encourage all of you to follow them because they do it right.
Yeah.
And that's just an example of a locally owned jewelry store that's taken upon them to get through this, and they're putting every effort they can into marketing online.
That's awesome. I know that I have spent way too much money in the last few weeks because of people like that. But I love having that experience. I do hope that that's something that'll continue even as we reopen and go out and about. I love that personal touch that a lot of our retailers are using, and even our restaurants and other service oriented, our fitness facilities and things like that. We have some really cool stuff going on. And it's a lot of fun to watch, and I hope that it continues. Okay, there's a couple things. Someone asked if we would save the chat. We'll absolutely do that and make sure that it comes out with the recording. And so just hang tight for that. We'll make sure that happens. There's good links in there and things like that, so you'll get to see those. Thank you guys so much for joining us today. I do want to wrap it up so that you guys can get on with your day. A couple of things I want to mention. We are at the very beginning of thinking about the recovery process. At the SBDC, we've been highly focused on helping folks find financial relief during this time, and now we're starting to turn to think a little bit more about recovery, and super excited about that. So this is just the beginning. Going forward, we're going to be having lots of calls like this on various topics with various speakers. So if anyone has a request, feel free to get that to us. I'm going to pull up our contact information here. You can reach out to us from RoanokeSmallBusiness.org or our email is hello@roanokesmallbusiness.org, and we'd love to chat with you about what resources you need or the needs that you have, and then if necessary, pass those on to other folks who can assist as well. We have lots of those folks on the line today, and I appreciate some of you have reached out already to me privately through chat, and I certainly will be in touch. Thank you guys so much. We do have a couple events I'll tell you about coming up tomorrow. We are having another discussion about the PPP loans and what's next with those. So the information that we have on tracking and calculating forgiveness, we would love to have you on that. It's another casual call, very much like this, where you can chat with us and we're learning together. So I hope that you'll join us for that. You can register over on our website. If you go to our COVID-19 page, you'll see it there in the sidebar. And then we have a really cool event coming up on May 5th at 12 o'clock with the Blue Ridge Public Relations Society. And they're going to be talking to us about crisis communication and really communicating to your customers as you begin to reopen. And we're so excited to have them. We've been to some of their workshops and we love them. And so I hope that you'll join us on May 5th for that. Registration will go up here in just a little bit on our website. And I hope that you'll just stay tuned with us. Let us know what your needs are. We are a super casual group like today, and we want to continue to converse with you and get you the resources that you need. And if it's not us, we will find them for you. So thank you again for everyone being here today. I'm going to save the chat. I'm going to pause the recording here and make sure that we get that all out to you. We'll also have it available on our website. If you want to reach out to me today, I am going to be managing our email at hello@roanokesmallbusiness.org, and feel free to do that. Or you can hop over on our website. We have a live hotline chat, and I try to be as available as possible on there, and you can chat with me there or leave me a message and I'll get right back to you. So thank you again to all of our partners, our economic development partners, Chambers and Tourism Office. We appreciate you and the love that you have for our small businesses and the work that you're doing kind of behind the scenes. Not a lot of people know about all the hard work that's going in to support the small businesses, and we really thank you guys for that. Thank you to our guests for being here today. I know that none of us have a lot of time right now that are in the support industry. So I really appreciate you taking a little over an hour to be with us to talk to the small businesses of the Roanoke Valley, New River Valley, and Alleghany Highlands. We really appreciate you guys. I'm going to close this out. I'm going to try to open up the poll again. So if you want to stick around for a second, there we go. I think I have it up. And if you would like to participate in that, I'll leave it up for a minute and then share the results of that so that you can see it. Thank you guys again. Does anyone have any final words from our guest? Or you can at least wave bye, right?
No.
Thank you guys so much. Thank you.